See important safety information at the end of the video.
When you're using microdosing, it's very safe. There, of course, is a risk of surgery, with any of these implants. But some of the main concerns that I find people have give a lot of pushback to the initial concept. So I think once we come to understanding that they do work, that we do have long-term data, that it's a viable therapy and it's meaningful, and it's, I think, important to be offering people. Once you get past that, then a lot of the initial pushback is, well, I don't want to get called from the hospital. I don't want to be on call. They're going to be calling me all the time. Pain crisis. They're going to call me because I'm managing this pump. When people would go in for a pain crisis, that was just really a high level of opioid tolerance and probably opioid-induced hyperalgesia from systemic medications. You really don't get that when you do microdosing with the pump. So, don't be scared. You're not really going to get called. These medications are safe to use intrathecally when done microdosing. I think any pain provider, whether they do medication management or only injections or stimulation but not pumps, everyone at some point in the back of their mind, they're going to identify someone whose life could be changed by this therapy. And just because they aren't doing it at that time, that's not a reason really to ignore that thought or to not present that option, because there's a lot of information out there. They can make a referral, but the way that the trial process can be done now is really safe to do, and I think any interventionist would really be comfortable with it.
Important safety information. The SynchroMed 2 infusion system is approved for the long-term delivery of preservative-free morphine sulfate sterile solution and preservative-free ziconotide sterile solution directly to the fluid around the spinal cord for treatment of chronic pain. Targeted drug delivery should be considered after the patient has tried oral medications or other therapies that have failed or were associated with intolerable side effects. Implanting the system has possible risks, including infection, meningitis, spinal fluid leak, paralysis, headache, swelling, bleeding, and bruising. Pump or catheter problems can cause a patient to experience overdose or underdose and/or corrective surgery. Errors in inserting the needle into the pump refill septum during the refill procedure can result in medication being inadvertently injected into the pocket, resulting in an overdose that may be life-threatening or fatal. Drugs infused through the system may result in adverse events. Refer to appropriate drug labeling for prescribing information and detailed disclosure. Formulations not indicated in product labeling may contain neurotoxic preservatives, antimicrobials, or antioxidants, or may be incompatible with and damage the system. A prescription is required. Healthcare professionals must review the product technical manual and appropriate drug labeling prior to use for detailed disclosure. For complete safety information about Medtronic targeted drug delivery, call Medtronic at 800-328-0810 or visit Medtronic's website